sequence of breathing. Suppose if we take a normal individual, so here how the sequence of breathing is going to be happen. Suppose this is the rib cage. Here we will be having sternum. So here these are our ribs. Okay, so here we will be having the muscle. That muscle is the diaphragm muscle. The muscle name is diaphragm muscle. How the inspiration will start means, first the diaphragm is going to contract. Then it is going to move downward. If it move, then it will come downward. If it comes downward, here the thoracic pressure will increase. Internal thoracic pressure will increase. Because of the increase of the internal thoracic pressure, it is going to create the inspiration movement. At the same time, the diaphragm which came downward, here we are having abdomen. This is our abdomen. This is umbilicus. Okay, here we are having the abdomen. The downward movement of the diaphragm is going to increase the intra-abdominal pressure. Because of this pressure, it is going to downward. The pressure, it will shift into lateral side. So because of this lateral pressure, the pressure is going to create the movement on the lower rib cage. It is upward and lateral movements. Upward and lateral movements of the lower rib cage is happening through the pressure which came from the diaphragm muscle into the abdomen. The pressure it is converted to lateral, so that it is happening in the lower rib cage lateral movement. So this is also one point for the inspiration movement. And here the muscles, scalene muscles which are present here, scalene muscles, and at the same time here parasternal muscles, nothing but the intercostal muscles, parasternal muscles. These scalene muscles, parasternal muscles, diaphragm muscle, abdominal pressure, all these together are going to create the movements at the rib cage. Those movements are pump handle and bucket handle movements. Because of these two movements, pump handle, bucket handle movements in the rib cage, the inspiration is going to happen. So if we come to expiration, the expiration, it is like a reverse. Nothing but here when we are doing inspiration, the lung tissue will expand. When it is coming to expiration, the elastic property of lung, it is coming to normal position. So that here there is no special mechanism for the expiration. It is like a passive. Passive phase of the ventilation. So this is about the sequence of the breathing. Clear?